impact of the disease. Some of you are already feeling social impact. You will have heard people talking in such a way as to suggest that there is panic. And panic is probably the worst thing that you could do in an epidemic. Panic cripples reason, and that is what we don't want. What we want is a free flow of correct information that empowers reason and changes behavior. So we are enlisting our young people in the fight against the epidemic by empowering you with information so that you can use that information in your household to have your household change behavior.
Thank you so much, Mr. Prime Minister. Already we have questions coming from grade 2 students. I see one from an 11-year-old as well. That sounds like a PEP student. But let's start off first by just getting an understanding of what COVID-19 is. And I think it would be a good chance to take with Dr. Simone Spence that particular matter.
Good afternoon. So COVID-19 is from a family of viruses called coronaviruses that can cause very mild disease such as the common cold, all the way up to more severe illness such as what we call pneumonia. Now, the reason COVID-19 is special, so to speak, is that we did not know about the existence of this particular virus until it was discovered in Wuhan, China in December 2019. So it is the fact that it is novel or new, which is why we're so concerned. It means, therefore, that we don't know a lot about it. We do know some things, but we don't know everything.
Thank you, Dr. Spence. Let me then go to Professor Sams Vaughan, because certainly this is a new experience for all our young people in terms of what they're feeling, experiencing, what they're seeing and reading in their books and on the television, what they're seeing. Help us understand from that perspective how we can help our children to cope as well.
Well, what has happened to children is that their whole structure and systems that they've been accustomed to, getting up every morning, going to school, all of that has been changed. And children, young people, even adults, we enjoy structure. We get up every morning, we go to work, we enjoy knowing what's going to happen. And then what has happened now is kind of suddenly the children are no longer in school, so their whole structure and systems are no longer operating. So that makes children anxious. What else makes children anxious is that they're hearing a lot. They're hearing things on the radio, and sometimes younger children, when they hear newscasts, they don't realize that it's the same 19 or 21 people. Every time they hear a newscast, they think it's another 21 and another 21 that are being affected. So the younger they are, the less they're likely to be able to understand what's happening on the news. And they also hear everybody talking about it. And if you listen to just regular people talking about it, everybody seems fearful. So children get fearful. So it's important for us that we teach children what they need to know so that they won't be fearful. And it's important for us to learn more about the virus so that we don't be fearful, so that we know what to do. Once we know what to do and we can tell children what to do, then we can help them to be less anxious.
Prof, I have so many questions already. I think we should go to the questions. Let me first say, though, that some of the questions today were submitted by children and young people across the island via your report. And your report is a social messaging tool made possible by the United Nations Children's Fund, which is used to learn more about the views of children and young people on a range of issues and to provide them with the relevant information. It's very anonymous, so we don't know exactly what your name is. All you have to do is just tell us your age and where you're sending your question from. And then we have some on Facebook, the Prime Minister's Facebook page, that many people are watching on that are sending in questions. So let me start with a few from the Prime Minister's Facebook page. And a grade 2 student, Israel Morgan. And Israel is actually a little anxious about school and learning. So Israel is asking, do we know enough tests? Do we have enough tests? Or would we run out of things needed for the test? That's from a grade 2 student. Can you imagine? Let me see who I can put that to. Let me put that to Dr. Espinosa.
Thank you for that great question, Israel. Let me just say that the World Health Organization and PAHO have provided tremendous support to the Ministry of Health and Wellness. We have, through Dr. Bullock-the-Cast, gotten some critical tests. I think we have 2,500 that were delivered last week, and arrangements have been made to provide those on a state basis. So yes, we do have enough for the country.
Fantastic. Thank you so much. Wow, okay. James Morris, a grade 2 student, is asking Mr. Prime Minister, is coronas a lot worse than the flu?
Well, I'll defer to the medical experts.
Okay.
All right, so again, because it's a new virus, we can't definitively say yes or no, it's worse than the flu or not. But we do know that it has a similar pattern to the flu. And so depending on what happens, we'll get to know more as more evidence becomes available. At this point in time, we recognize the fact that there are certain subsets of persons that are more vulnerable from getting more severe courses of the disease. And that is why we are more concerned about our elderly population, for example, and those persons who have other diseases such as diabetes, heart disease, high blood pressure. And so why it is that we are promoting that these persons take special care, because we recognize that the disease can impact them a little bit more significantly than it would young adults and children and youth.
Well, just to add another dimension to it. So yes, the epidemic, the disease, has the medical and public health aspects to it. But once you get into the consideration of an epidemic, then you have the economic and social impact. And so far, because it is a novel virus, meaning we don't know, it's new to us, we don't know enough about it, it is having a tremendous impact on our ability to respond. And so it will have an impact on our economy, it will have an impact on our education system, it has already had impact on our transportation and trade. So the disease is not just you getting sick, but it is the ripple effect through our economy and society. And so far, as it has been turning out, this COVID-19 disease has had a tremendous impact, far greater than what we now understand to be the current influenza flu virus.
And if I may weigh in on that discussion, I just want to reassure the persons asking the question that 80% of persons, will do well, okay? And as Dr. Spence says, the ones that we worry about are the ones with coexisting diseases, but rest assured, most persons will recover and have no sequelae afterwards, or they have no complications afterwards.
Wonderful. So our young people can be assured that, we are
do well.
fantastic.
Especially well, yes.
Thank you, Doc. I have one from Nicholas Sherrard. He hasn't said what grade he's in, but he says, Mr. Prime Minister, sir, thank you for doing this press conference for young people. He asks, what will be the outcome for students like me who are scheduled to sit grade 5 PEP exam soon? Okay, so he's in grade 5.
Well, I'll let the Minister of State give that response.
All right, so first of all, again, we want to welcome all our children and all our youth viewers to this digital town hall. The PEP exams, as you know, we are going to postpone the PEP exams, all right? We will give you more advice or more updates as soon as we get more information. Obviously, we're going to have to discuss matters as well with the cabinet. So when the Prime Minister sits with his executive team of government ministers, then they'll make further decisions. But for now, the PEP exams, they've been cancelled. We're looking at possible dates in June at this time. But of course, as we continue to monitor the progress of the virus in Jamaica, as we continue to have our discussions with the Ministry of Health, we'll be better able to give you a final answer. But we want to encourage you all, log on to the ministry's website, tune into TV. You can also go on EduFocal, one-to-one learning, and we will have a host of other websites available for those persons. We know that not everybody has a computer or a laptop or a smartphone, and sometimes depending on where you live, we know that the signal for the internet might also be weak. So what we're doing is we're going to be, well, right now we're in discussions with other cable network providers. We're in discussions with Minister Faber Williams from the Ministry of Science, Energy and Technology, and we're going to be working with NWA to get more cables in the ground, or more fiber optics, so that we can widen the scope. So like we're speaking with Ready TV, so we can get more cable channels into your homes so that you can have access. Already we've also started to train 180 teachers, and this is just the first batch, so that they can be able to give online courses and live TV presentations. All right, so this is for our PEP students and also for our CXC students. You would have been seeing the notifications about tuning into TVJ every day between 9 and 12, with repeat broadcasts on Saturdays as well, because we want to make sure that education, equal and undisturbed access to a good education for all our students.
Fantastic, Minister. Thank you so much. Let me go to you, reporters. Of course, we have several platforms for you to send your questions to. Facebook, the Prime Minister's Twitter account as well, social media. We're streaming live on OPM website, and of course, you report. Let me get to you report. You report a female from age 17 from St. Mary is asking, Prime Minister, how soon is the government planning to reopen places?
Well, the epidemic has a lifespan. It is almost like a natural event. And what we have seen coming out of China is that it lasted for about 2 months, and it peaked somewhere at around week 4 to 6. After that peak, then the number of new cases started to decline, and as they came out of the epidemic with a reduced number of new cases, then the government in China decided to loosen some of the measures for lockdown. So for example, in China, in Wuhan, started to lock down that city on the 23rd of January. And just last week, we started to hear that they have started to loosen the restrictions. So that gives you some idea as to how long the measures that we have put in place will last. It's very difficult at this time to say how long the measures will last. What we have been doing is to implement measures according to the threat level as we progress through the epidemic. So right now, we are at a particular threat where we have had to restrict persons by virtue of age. A group that is most affected, that is the group 65 and over. We have put in place general measures to control movement, such as stay at home, work from home. We have put in place measures to control gatherings. So now we started with 20. By tomorrow we'll be down to 10 persons gathering in a space. And there are other measures that we will apply as we progress through the epidemic and we see how many cases we have. So the measures that we have put in place have been very effective so far in keeping down the number of new cases. But as we reach the inflection point, meaning as we transition from what is called clustering, that is, we are able to identify the cases in a geographic area, or we have some connections established for transmission. But when we start to get into what is called now the community spread, where we can't determine where the infection came from, that is, we can't say person X got ill because they came into contact with person Y. That means the virus is just generally in the community. You could walk somewhere where the virus is on a surface, you could touch it, and you get ill. That now is when the disease will take off rapidly in the society. And from our assessment, we believe we're close to that point, we're getting to that point, and therefore we have put in place the measures to even to control movement in a much stronger way. One of the reasons why we're having this town hall with young people is to get you to understand the importance of obeying, abiding, and being advocates for the measures that are put in place. In particular, the generally recommended hygiene measures, which I'll allow the health professionals to go over, but some of the other social measures that are put in place. You might be wondering, so I don't see anyone in my community ill, so why can't I go to school? You may be wondering, why is it that my mom can't go to work? Or why is it that I can't go and see my grandmother? These are all very important questions, and I will allow the health officials and the experts to explain. But as I said earlier, sometimes in your household, you are going to be the one to have to explain, because sometimes the members in your household themselves may not be tuning into the news. They may not be reading what is on the social media. They may not be communicating with persons that have the knowledge and persons who can inform. So I'm enlisting you in your household to be the one to be the advocate for the necessary behavior change to ensure that COVID-19 does not come to your community and it doesn't come to your household.
Thank you, Mr. Prime Minister. Karen from Facebook is saying, thank you, Mr. Prime Minister, for making it very simple for us to understand. I have one for the clinicians, and the clinicians really are the doctors on the set for those who are watching. Zachary, who's a grade 2 student from Jeffrey Paul, is asking why corona is so dangerous. I think that was answered a little bit. But then Owen as well wants to ask, what is the chance of survival for an asthmatic person? And so many young people suffer from asthma.
Right. So let me answer that question. Thank you for that question. It's very important because the asthmatics are one of the types of we pay special attention to. Now, as you know, your asthma symptoms, really, you recognize the symptoms, the shortness of breath, the wheezing, etc. But you know your symptoms better than most persons. So once you recognize that you are now getting short of breath, you're wheezing, or you feel generally unwell, let your parents know, let your care provider know, and immediately head to the hospital. When you get to the hospital, they will prioritize you. But the most important thing is recognizing your symptoms early.
Thank you so much, Doc. So then let's go to France from Facebook. France is a young adult, early 20s, France says, and they want to know what help is being given to young people like me that can't continue to work because of this.
So that's a good question. So that is not part of the health impact of the virus. And so the question was asked earlier, why is the virus so dangerous? Clearly it's dangerous to health. And by virtue of its novelty, where we don't now have a vaccine and we don't have established treatment regimes and medications that are fully accepted, we also have the social impact. And that is the possible increase in unemployment as a result of the virus. The government later today will announce some assistance, what we call a stimulus and care package that will assist persons who have been laid off or who have lost their jobs as a result of the economic fallout. The program really would not be able to cover everyone. There will be specific rules that apply, but later on today we will explain fully how the government intends to assist persons who would be so affected.
Thank you so much, Mr. Prime Minister. Let's go back to our You Report questioners. I have someone a female from Kingston and St. Andrew, who's asking the response at the moment in terms of playing football games and going to the park. We are not able to move as much at Kingston and St. Andrew. I'm not sure what Kingston, no, the person is 19 from Kingston and St. Andrew, asking about with the limitations really in terms of 20 persons now to 10. They're wondering what about their football game, essentially.
Definitely no football playing, definitely. So the restrictions are aimed at lessening the probability of infection. That's what it's not going to prevent it absolutely, but it will certainly dramatically reduce the probability of the infection. So there are some activities that give a higher probability. So if you go to a sporting event and you're in the stadium, that definitely would have a higher probability of getting persons infected. If you're not at the stadium, if you're at home and no one in your home has it, then you have a even greater probability of not getting it. You see it to extreme. So we're trying to get people to be at the end of the spectrum where they are not in close contact with a large body of persons. So now we are saying 10. 10 still allows for the functioning of the society. You can still do basic things such as going to the pharmacy, essential to get medicine. Going to the supermarket, essential to get food. If you have to move about, that's critical. But what we don't want you to be doing is going to a meeting and gathering in a closed space. That's definitely what we don't want you to be doing at this time. So football, you know, people have been asking me, what about gyms and spas? And I would say definitely you would want to have the gyms restricted at this time, and the spas as well.
I thought, Minister, yes.
If I could just add as well, Prime Minister, you know, we want everybody to take it seriously. You know, I don't want the youths them on the corner to think, say, boy, the government are fight against them and we don't want nobody playing a football. I don't want the girls them playing the netball. Think, say, boy, we don't want nobody playing netball or anything. We want you to play sports, but just exercise by yourself for now. Take the thing serious, because at the end of the day, you might think, say, boy, you're invincible and nothing going to do you. Always remember, the safest person is yourself, because you can't tell who have the coronavirus by looking. You can't. So you might think, say, boy, yeah, my bridge and I'm going to play some football, I'm going to play some netball and things. But guess what, know? Everybody look fit and healthy, but one person has the virus and none of them don't know. That person that will infect the 12 or the 24 of you on the field or whatever, then you now go back to your different homes and then you have the spread. So bear in mind.
And go and hug up grandma.
And there you go. You bear in mind, you go home, you hug grandma. Poor grandma is 80 or 75 or 65. Grandma now gets very, very sick. You go and hug up the baby. You go and hug up your little cousin that have asthma. So all of those things.
That young person will go home, probably not show any symptom, probably just say, oh, I have a cold, just a little cold, recovers, and poor grandma is struggling for weeks.
Doesn't recover.
I would also like to remind the target audience that we're now seeing the disease in the 24-year-olds to the 79-year-olds. So just a reminder that it's still affecting the very young as well.
Yes.
And the evidence shows that.
And I wanted to add to you, Minister Terry, that exercise is really important.
Yes.
Exercise helps with your immunity. Exercise keeps you stronger. So since you can't exercise in groups, as Minister just said, exercise by yourself. It's important to keep exercising.
Yes. And one of the things we've seen coming out of the COVID crisis, we've been seeing these push-up challenges online. So listen, you can stay home, you can do your push-ups, you can jog on the spot, you can run around the house, you can run around the yard. We want you to stay fit. We just want you to stay fit in a very, very safe way. Remember, every single measure the Prime Minister and the government puts in place, our Health Minister, is to ensure your safety. At the end of the day, your life is important, the life of your families and your loved ones, and that's the aim right now.
I also want to
yes, if you could, Dr. Spence, yes.
Just to say in terms of, so I think it's important, especially for children and young people, to also understand how the virus is transmitted.
Right.
And in terms of the fact that it is what we call droplet and contact spread. So somebody gets infected and start having symptoms usually around day 5 or 7 of the illness. They start coughing and sneezing, and that cough or sneeze sends out droplets that have the virus inside it. Then you may touch a desk or a keyboard, for example, using your computer, and it's on your hands. The hands then go to our faces, which is the eyes, the nose, and the mouth sometimes. And so we are not always conscious of these little things that we do. So this is why it's so important for us to practice and also help to remind our friends and our family members about hand hygiene. Yes. So the hand washing cannot be overemphasized in terms of washing your hands with soap and water for at least 20 seconds. We tell persons to sing the happy birthday song to yourself twice, just to remind you that this is how long we're supposed to be washing our hands for. Using your alcohol-based hand sanitizers as well, if it is that you don't have immediate access to soap and water at that point in time. And the other thing I want to point out, the importance, as you said, about gathering together in crowds and keeping it at 10. But the physical distancing is very important as well. So even with that group of 10, it cannot be a group of 10 wherein we're not maintaining at least the 1 meter or the 3 feet between each other. Because again, when you cough or you sneeze, you might not be actively ill in terms of you're feeling that I'm coming down with cough or cold. It might be early, but viruses are still within the droplets. And you cough and sneeze and it lands on someone and on their clothes, they touch the clothes and then again to the eyes, the nose and the mouth.
So we also want to reinforce the social etiquettes as well with sneezing in your elbow joints, or you cover your mouths so you don't disperse those droplets.
Indeed. Thank you so much. And of course, we're almost practicing the social distancing. We have a good arm's length with everybody on the set today. Okay, let me get back to you reporters. Some questions coming in from students. A nice one from a female out of Trelawney who is 13, and she asks, well, why are you keeping online schools when you said schools should be closed?
Well, listen, schools are closed, but we're not stopping education. Education continues, and what this has actually done is to show the power of the online medium. The truth is that we have always had the capacity to conduct classes online. We just have not used it, but we are forced to use it. And I think school administrators and educators are now coming to respect the medium as a very powerful medium for the delivery of knowledge. And my own assessment is going forward that we will have to be using this now far more than we did in the past.
All right. I have another one for you from out of town, from your Facebook page, Prime Minister. Suzette Wint is asking, what about students in rural communities that don't have immediate access to the internet? What measures are being put in place, especially for those in
Minister
remote areas?
In advance of that question, I'd given an answer.
Yes, indeed. Let's also, there's one from a member of the disabled community, and I'll ask Professor Sams Vaughan Deja, I believe her name is asking, well, what specifically will happen to our schooling? Will we get more time to graduate to the next grade?
That's more.
Yes.
Okay, let's
to say
yes,
that
yes, Prof.
we must take special care of our children with disabilities, and we need to ensure that the messages are getting to them. So we're asking parents for the visually impaired persons to ensure that we are speaking with them and making sure that they're getting the messages as well, because they're getting anxious too, because they're picking up on the anxiety around them. The hearing impaired, the children who are intellectually disabled, whose minds are working at a younger age than they actually are. We're asking parents to ensure that they talk to their children and tell them exactly what's happening. Get all the facts and make sure you speak with them so that they will not be anxious. Minister?
Before Minister Terrelong takes the question, though, I'd want to just tell our panelists and viewers the Prime Minister himself commissioned a comic really to help our young people fully understand the COVID-19, and we're going to share with our viewers shortly how that's very, very important and interesting story. But Minister Terrelong, if you would.
All right, thank you, Naomi. So this is a good time to address CXCs. Many of you would have been messaging me on Instagram and Twitter as well, asking about what about the CXCs and the CAPE, etc. All right, so right now everything is subject to cabinet approval, but we're looking at two options along with our regional partners. We're looking at delaying, or what you call postponing the CXC until somewhere between June and July. That is scenario one. Again, depending on what is happening in Jamaica, across the region, and of course we will continue to be advised by the Minister of Health and by the Honorable Prime Minister. Scenario two would be considering delaying the CXC and the CAPE exams until September-October period. If we delay the CXC and the CAPE until the September-October October period, again, this is all subject to what is happening with the local spread, subject to the Ministry of Health and the advice of the Honorable Prime Minister. Then we would be looking at perhaps a new school year, because if exams are in September, October, we would not be able to mark the papers until November. Results would be had by December, which means that now we'd be looking at a new school year, which would start in January 2021. For the first scenario, if we look at postponing the CX and the CAPE exams in the June to July period, again, we will not be able to mark the exam papers until about August. Results would be had maybe by the end of August. Again, that would see a late start to the next school year. Certainly, once the decision has been made, we will have dialogue with, for example, those transitioning from Cape to university. We'd have to have dialogue with universities, because we would need the universities to agree as well to have that pushed back in the start of this, to the start of the school year. But again, certainly your health is our priority. We're looking at the multiplicity of scenarios, keeping in mind that we do not want education to be disturbed. Notwithstanding, we still want everybody, as the question the Prime Minister said, the school, the physical school building is closed, but education continues. So it's for every, listen, you see, once you discipline, right? Once you discipline, and your parents are there to help you as well, and you know, Prime Minister has always indicated that we want to include the family, because the family must be a part of the educational structure. It can't be government and the teachers them alone, you know. You understand? So we want the home, the parents and the older brothers and the older sisters. We want everybody to be involved. So this is a good way now for that family bonding. That mommy can help the younger ones with the 2 times and the 3 times. The older brother can help them with the physics and the chemistry or the engineering and the woodwork. So it continues online and on television.
Minister,
yes.
just to say that as it relates to the exams, and it could be quite a bit of anxiety around them. Everyone should recognize that this is a system-wide disruption.
Yes.
Meaning that everything is disrupted. Right across the world, right across Jamaica, right across all communities. And therefore, the government has to look at how it sequences everything when we get back online.
Right.
So one of the things you can be assured of is that we would not place you at a disadvantage, because obviously this was not your fault. So we will make the best decision to ensure that you are not disadvantaged in any way. So there are many ways to treat with the situation, and we will figure out the best way in partners in CXC, because remember, it would not be a Jamaica decision alone.
Thank you, Mr. Prime Minister. Dr. Espinosa,
I just
yes.
want to say education is very important, and I know there are a lot of young people out there who want to become doctors like us here on the panel, and so we endorse the view, or Prime Minister. So we want to encourage those young persons in our target audience to continue use the resources that are available, because we want you to be taking over from us in about 20 years' time.
Indeed. Thank you so much, Doc.
In fact, Naomi, just to indicate that Cabinet also, if I may, Mr. Prime Minister, Cabinet has also approved the acquisition of 100,000 tablets. All right, we're expected to have the first 40,000 of those tablets by June. 16,000, the first 16,000 will be here shortly as well. So why we're doing this again as a government is because we understand that some persons don't have access, and we want to make sure that, as I said, equal access, equal undisturbed access to education. So we will have, again, provided we will have the right resources distributed, just like we've been doing with the PATH program, so that we ensure that those who are on PATH program, you continue to get your meals every single day through the corporate organization, the principals within the school system. So you can expect an additional assistance by virtue of the tablets that will be coming out soon.
Thank you so much, Minister. Prof, I want to go back to you, because there are specific questions, especially for persons with disabilities. Cherna wants to find out, what are you doing, and I'll read the question as is, what are you guys doing for children with ADHD?
Now, children with ADHD, enjoy structure. They really need structure. So their parents will need to make sure that their day is properly structured, because they really need that structure to function. It's a good thing the Ministry of Education has put out schedules for parents to follow so that children can have structure in their day. But it is really important that parents make sure that they're structured. The other thing that's really important for parents to do with regards to structure is to ensure that children are safe. During holiday periods, and though this is not a holiday period, it's similar in that children are at home. During holiday periods, children have a higher risk of injuries, accidents, and abuse. So we need children to be careful about their surroundings, be careful about what's happening in their environments, and we need parents to be especially careful about children in this particular time.
Thank you so much, Prof. And one of the things that I want to point out as well, we ensure that we at least try to bring in as many of the members of the disabled community. I mean, we also have all of the press conferences with sign language support. Also helps that process. I have one for you, Prime Minister, from a university student, and I have several really that are in a similar vein. So let me take the one from Melanie Lothian, who asks, as a university student and school remains closed, would I have to redo incomplete modules and pay again to have them done?
Well, it's very difficult for me to answer on behalf of the university. Each university will have their own requirements, except to say that, I said it before, this disruption is not your doing. And once you have complied with all the notices and requirements of the university, then the government would not support any measure that would place you at a disadvantage. So I think the universities should pay attention to that statement as well. And I think you should take comfort in knowing that the government will have a very keen eye in ensuring that students are not unfairly disadvantaged or penalized for a disruption that was not your doing.
All right, fantastic. Thank you so much, Prime Minister. I think, many people would have been comforted by that, especially university students who there are many questions from them just concerning that one particular issue. Let me go back to the U report questions. Out of St. James, I have one from a male who's 22 who says, how many COVID tests are being carried out each day?
Well, that number varies because it depends on how many persons that we suspect possibly could have the virus, and therefore they're screened and tested. To date, we have tested 124 up to yesterday's figures, and 99 were negative. We do know we have 21 confirmed cases to date. But again, those figures change, and this evening in our press conference at 5, we would then be able to update as to where we are at with that again.
I also want to remind Naomi that this is the influenza period. So in addition to dealing with COVID-19, we also have the regular viruses, influenza included, A and B. We're also within the dengue situation as well. So there are other things going around that we are also addressing from a public health standpoint.
Thank you so much, Doc.
I think, Naomi, it's important just to make the point now that, as a government, we don't practice discrimination, and we're asking everyone. So, don't be careful and be cautious, but you're not going to scan nobody and you're not going to beat them up. We've been hearing reports say, a man might push another man because he coughed, or, we've been hearing those reports, and what we're saying to the public is just no panicking, all right? And don't resort to violence or abuse or sort of disrespectful discrimination kind of behavior if you suspect someone might have the illness. I heard one doctor say, I think it was the CMO, but what one doctor indicated that, a year from now, once the scientists have gotten a better understanding and the doctors can speak to, but a year from now, it's going to be like a regular cold, Business as usual, right? Okay, good. So the doctor has said, because I was kind of like,
this too will pass. This too will pass. We've been through a number.
I disagree. I think you will have a new normal in operation. So once you have a vaccine in place, then clearly you would be able to have a greater control.
Absolutely.
But what we have learned from this is that you cannot dispense with the recommended hygiene practices.
Absolutely.
I think you are not going to forget social distancing. So that is going to be, that is now in our vocabulary, it is now in our thought process. You might very well see less handshaking.
Yes.
In the same way, after SARS, people started to wear masks, and even up to this day, people are wearing masks. In other words, it is now within our culture. And I believe it is good that it is within our culture, because the same precaution that is taken against the COVID virus, it's the same precaution that would work for influenza.
Absolutely.
So I think the greater awareness in the population, and particularly with young people, being aware that as we become a far more connected society, which we are, some of you are traveling to far-flung places, and as our economy expands and the global economy expands, and many of you are aware of climate change and the impact of economic expansion on the climate. It is not just the environmental issues that we have to pay attention to, but also bringing in novel diseases, new diseases into our population, and how our population will respond to it. You have to be very cognizant that the future in which you are going to inhabit and live in will have these threats to humankind, to your life. You have to be able to adjust to that.
You know, we only have about 13 minutes left. It really is an hour, and I'll tell our young people that today is a very important day. We conclude the budget debate, and of course the Prime Minister has to be in Parliament to deal with that, as well with the Minister of Finance. I have a question concerning budget, actually, Prime Minister, coming from a male 24 in Kingston and St. Andrew, who says, I would like to see an increase in the budget for the Youth Adolescent Policy Division, because after we've passed through the pandemic, there is a social and mental issue that our youth will have to face.
Well, I'll first of all invite him to join me in Parliament. So that person obviously has a keen eye on policy, and I agree with him. And I'm certain that Minister Terry Long, did you set him up to ask that question?
No, I did not. But
because
I do
Minister
agree.
Terry Long has always been asking for an increase in the budget. So yes, it is something that we will have to pay very close attention to.
Prof, if you would weigh in.
Yes, but Prime Minister, there are going to be persons who are going to get exceptionally anxious, and these persons are asked to contact their local health service, because anxiety, depression, a lot of mental health problems can arise because many persons are put in situations that they weren't previously in. Many persons have been in quarantine, in isolation. Many persons are confined to homes. And it's important that we understand some of the mental health issues that are going to happen to not just adults, but to young people and to children. It's important that we understand that children might have very difficult behavior just now. They might not sleep as well. They might be irritable. They might not eat as well. And that's because they can't tell us how anxious they are. The child who is older will be able to say, boy, afraid is he? But the younger child is just going to act out. And we ask older children, young adults, to be cognizant, to understand what's happening to younger children. And in a more general way, that persons seek help when they can't manage or they can't cope with the challenges that their children are having, or with the feelings that they themselves have about being anxious.
Professor, can I take it another level? Because a lot of parents are watching with their children. We're getting a lot of the photos coming in of them actually tuned in. How can parents properly and practically help in this time as well with anxious children?
All right. So the first thing is for parents to get information themselves and make sure that they get the information from the right source. There is so much that's out there that is so wrong. So parents need to inform themselves from the WHO, from the Ministry of Health, from sources that we know to be reputable. UNICEF. Sources that we know to be reputable. So parents arm themselves with the proper information. That's number one. Number two is for parents to ensure that they speak with their children. Please note I didn't say speak to, I said speak with. Speak with means that you speak and you listen. So you give your children the information, but hear from them what they're thinking so that you can address the concerns that they have in the way that you can best do so. Give children information at their level. So a preschool child may only need to know now that, why I can't go to school. They only need to know that, a lot of people are getting sick and don't want you to get sick. So we are making sure that we are keeping healthy by keeping you at home. They may not need to know a whole lot. Your son who is doing biology at school may be able to tell you more about viruses than you know. And so it's important for you to have a discussion with your children at the level that they can understand. Finally, it's important to tell your children when you don't know. If you don't know the answer to something, tell them you don't know. And tell them that you're going to find out. And ask them to help you find out. They may be able to find out quicker than you. Because they know, they know how to get on the social media. What you need to do is to get them as to the media that's accurate and that they can understand. And, we try, when we see our children getting anxious, we hug them a little more, we cuddle them a little more, we make them feel more secure.
Thank you so much, Prime Minister. Yes.
The National Parenting Support Commission, this week we will be rolling out 32 phone lines to help parents to answer any questions you have about your children behavior, how to create an appropriate learning environment for them at home, how to adjust, how the family itself will adjust to life in this time of COVID crisis. So it will be 2 phone lines per parish. Kingston and St. James will have 4 lines each. So we'll publish the phone lines. Issues.
And just to piggyback on that, sorry, Prime Minister, we still have the 24-hour helplines in the Ministry of Health and Wellness, all fully functioning, operational. Technical guidance is provided for the parents if they need that sort of expertise. So
we've just commissioned a comic. I don't know if people still read comics. I used to read comics when I was growing up. But we hope to convert that into an animated series. So it has quite a bit of information about the COVID virus, the COVID-19 disease, how you should cope, how you should respond, and trying to seek behavior change. And we will be having a preview of the comic here today. But as I started by saying, I want to enlist the support of our young people in being agents of behavior change for us to be able to be strong fences in containing the spread of the COVID-19 disease. So we don't want any weak fences. We must all be strong. And what that means is that we have to be able to resist the impulse to disobey, the impulse to break the law, the impulse to disregard the advice. We need every single Jamaican now to come on board and say, we are going to observe the guidance, the recommendations, and the orders that are given. We're going to comply, and then afterwards we can complain. But let's comply. So if the government says, we are asking all persons who can work from home to work from home, compulsory in the government sector, and the private sector should look at their own operations and make that determination. We are expecting parents to comply. So you, as a young person in the home, should really be asking, Mom, can you work from home? Why not? Conversation. That's how you become an agent of change. Because I do know of situations, for example, where the parent decides to go to work, even though they are ill. We don't know what they have, but they are showing influenza type, flu type symptoms, and go to work. Now, I'm hoping that our young people who would have watched this program today would become agents and say, Mom or Dad, you're sick. you should not really go to work. Call in and explain. And if you are showing signs of distress, then don't just jump on a taxi and go to the hospital. Call ahead. Get support. And we want to enlist you in this, because it is when our young people make the change that the entire society changes. And that's the purpose of this digital online town hall. And by the way, as we progress through the epidemic, we will be using this format far more in interfacing with you, the people of Jamaica.
Thank you so much, Prime Minister. That's very, very important. I want to squeeze in two more. And I wish I could do a voice like yours, because this comic is so very interesting. If they could go to page 1, for example, where you start off by making the announcement, the government will be closing schools for 14 days. I can't do it as deep as your voice. But really it tells the story of a little girl, her grandmother, her mother, having to listen to the announcements that you've made, sir, and how they deal with it. The main and overarching message is really that COVID-19 is not a death sentence, and this is very important as the children maneuver the comic as well, and we hope that they'll find it very, very important and informative as a tool for them to educate themselves and to help others as well throughout this period as well. So we'll make it available online for those who are watching. We will make it available online, sir, and I'm sure that at some point when you pop up at somebody's school, you'll read the entire story for them as well. I have one more question, two actually, from our young people. One having to do with the doctors who can answer that. Can you get COVID-19 twice? And Mr. Prime Minister and Minister Terrelong, given that a lot of the young people, especially 20-year-olds, like to party, they're asking specifically about when are we going to be able to party again? So we'll close with those two questions.
So as it relates to whether or not you can get the virus twice, we don't know enough at this time about the novel coronavirus. So perhaps in another 6 months to a year, when we have more knowledge about the virus, we can answer that with more evidence-based medicine.
All right, thank you.
Well, I've been seeing parties online. Someone sent me a link. And
we went to one, Mr. President. we went to.
I don't know about that. but I've seen where they move parties.
Big part online.
Yeah, they move parties online, and everybody seems to be quite fine. Well, look, we will get through this crisis together, and we'll have a big social distancing party after. But you know, we are now in the very early stages of the epidemic. Things are going to get worse in terms of the number of persons who will get infected, and it is very important that mentally we are prepared that this will happen. However, we do not have to reach an uncontrolled peak, meaning that we have taken the measures to suppress the highest number that could possibly happen. And we are trying to suppress that number to be within our capabilities to respond. And our capabilities to respond are determined by the number of beds that we have with support, meaning ventilation, ventilators and other forms of support, nurses and doctors. If everyone plays their part, we will overcome this in a way that we can all be proud of, and in a short period of time. But you should bear in mind that COVID-19 and the virus that causes it, the corona SARS-CoV-2 virus, it's such a long name, that is now in our society. It will be there for a very long time. I doubt it will disappear, but we would be in a far better position in managing it. So do your part. Be a strong fence. Encourage others to be a strong fence. And if we are all strong, then we'll be able to keep the virus from spreading in the society. Thank you.
Mr. Prime Minister, thank you. I want to thank all the members of the panel as well. The Honourable Alondo Terrelong, the Minister of State in the Ministry of Education, Youth and Information, Professor Sams Vaughan, who is Professor of Child Health and Development, Dr. Simone Spence, Director of Health Promotion and Protection in the Ministry of Health and Wellness, as well as Cordell Espinoza Campbell, Acting Director at the Emergency Medical Services at the Ministry of Health and Wellness. Thank you so much. We've enjoyed asking, and of course the panel has answered your questions as many of you posed. We've seen all the pictures as well of those of you seated in front of your computers, your television sets, with your parents' phones watching. We thank you so much, and we want to have you join us again. Now, today we focused on the young people. Tomorrow the Prime Minister will take some time to focus on the older ones. Of course, you know, the Prime Minister mentioned yesterday that there is an order for those 75 years and older to stay indoors. So tomorrow we want to engage those of the older ones of the population and help everybody through the coronavirus, the Corona-19 virus as we call it. Thank you so much for joining us. It was our pleasure. The Prime Minister is off now to Parliament to ensure that we pass the budget and to make sure that he takes care of the rest of Jamaica. Thank you for joining us, and join us again tomorrow.
Reduce your risk of viral illnesses like the flu and coronavirus. Wash your hands frequently with soap and water. Cover your nose and mouth when coughing with a tissue and dispose of it. Avoid close contact with anyone with a cold or flu-like symptoms. If you become ill, please visit your doctor or the nearest health center and share your travel history. The flu and coronavirus can kill. Let's protect each other. A message from the Ministry of Health and Wellness. Reduce your risk of viral illnesses like the flu and coronavirus. Wash your hands frequently with soap and water. Cover your nose and mouth when coughing with a tissue and dispose of it. Avoid close contact with anyone with a cold or flu-like symptoms. If you become ill, please visit your doctor or the nearest health center and share your travel history. The flu and coronavirus can kill. Let's protect each other. A message from the Ministry of Health and Wellness. Reduce your risk of viral illnesses like the flu and coronavirus.